So, our next topic is all about housekeeping. Okay, it's your guide as caregiver how to do a proper housekeeping. Okay, as caregiver, you're responsible also to do household chores. So, let us find out what are the right way in doing it. So, let us start with planning. If you're doing household chores or housekeeping, you should always follow the service plan. Okay? Then you may be held liable if you do something for the client that is not on the service plan, especially if you're contractual and you have agency. Okay, you should always follow what's in your contract. Then you should make a list of your tasks so it will be organized and uh, you can do all the tasks that is in your list accordingly. Then ask the client to prioritize the task that needs to be done. Then always remember that all your patients or your client has rights. So you should always respect that. So be considerate and cautious of the client's supplies, equipment, and furnishing. So you saw one patient that is rich, is billionaire, then you're wasting all the supplies, equipments for cleaning. So it's not right. You should always be considerate with the patient and the family. Show the same respect for the client's property as you would for your own. Then the client has a right to be a hoarder. Then the client has the right to refuse. If your patient don't want to have bed making or cleaning of the room because you don't want to be disturbed, first is to explain the patient what is the risk of not cleaning his room. Then, if you refuse again, okay, you respect the patient. So, what are the 5S of maintenance and procedures? We have the Seiri, Seiton, Shizu, Seikatsu, and Shitsuke. So, this is Japanese term. Seiri for sort, Seiton, you should be systematized. Seiso, sweep. Seikatsu is sanitize. And Shitsuke is self-discipline. So these are the 5S of maintenance and procedure that you should always be familiarized of. Then, for supplies, maintain list of items in short supply. Have a shopping list. Adapt to the client's households. When using cleaning products or appliance, always read the label and follow the directions fully. Look for any warnings. Use protection. For example, if you're mixing uh, disinfectant, you should always wear mask because it can irritate your hands if you use your bare hands. Be considerate of the client's financial resources. Then, what are the floors or types of floors we are cleaning? Okay, we have two types of floors. We have the resilient floor and we have the hard floor. So resilient floor examples are linoleum, vinyl, rubbers, while hard floor, that is marble, ceramic tiles, and terracotta. So what are the types of floor and cleaning maintenance that we are using? Okay, first is sweeping. We have the dust mopping, spray buffing, plain polishing, floor stripping, and then extraction. So if we're telling sweeping, sweeping is pagwalis. Dust mopping is it's like it's mopping of the dust, and then spray buffing, you're spraying a disinfectant, okay? Then you're mopping it. Then plain polishing, you're using a polisher. Floor stripping, floor stripping is like you're using a machine to strip the floor, and then extraction is you're using also a machine to remove the excess water. So what are the techniques? Okay, this is being asked in this is one question in test the certification. What is the technique in floor mopping? Okay, So you should always remember what I'm always saying to you, that you should always clean from cleanest to dirtiest. So always remember that the cleanest is far from the entrance or the door. So you should always start from uh, back of the room and then towards the door or the exit. And you're using uh, a stroke, which is a horizontal figure eight stroke. You should always use a horizontal figure eight stroke. Okay, so you will not step step out to the area that you clean. Then use a clean mop and then change mop water frequently. If it's very dirty, you change it. Then if you're mopping vinyl, use mild soap and rinse with clean water, warm water. If you're cleaning ceramic floors, use vinegar and water. Vinegar is a very good disinfectant. That's why they are using vinegar and water. Then carpet, you should vacuum it frequently, especially if your patient is asthmatic and or allergic rhinitis. With allergic rhinitis, you should always vacuum the carpets because dust is always going there. Then cleaning appliances, you should always clean the appliance. If it's dishwasher, you should clean exterior to interior. Freezer, you should defrost it once a year, but others they are defrosting it every month. Then wipe inner surface with a damp cloth. Check for outdated food, okay, and then dispose the food with the client's permission. Cleaning refrigerator, clean inside and outside with soft, wet cloth and mild soap or baking soda. Baking soda is a good uh, cleansing material also. Then check for spoiled food and dispose. Trash compactor, always replace the bag as needed so no cockroaches or any insects in the trash. Then garbage disposal, you should run cold water during use and for 1 minute after. Orange, lemons, and ice can be used to maintain freshness. So that is those fruits which is with vitamin C or acidic, you can use it as disinfectant. In cleaning microwave oven, you should wipe with cloth and soap, rinse and wipe and dry. Stove oven, wipe up spills and grease immediately because as I've told you, it can build up a fire. Then clean oven with vinegar in water to remove grit. Washing machine, you should always wipe exterior and interior with soft wet cloth. Clean also the lint filter kasi yun yung sumasala ng mga maliliit na fiber at pag nag-init ang washing machine, naipon yun, pwede yung magkaroon ng fire. Then, dryer, clean lint filter, a heavy buildup can catch up fire as it told. If you're washing the dish, always remember the order of washing the dish. You should be washing first the glasses, then silverware, your fork and your spoon, and plates and cups, pots and pans. Bakit pots and pans ang huli? Kasi mamantika yon. Pag mainuna mo yon, lahat ng mantika pupunta uh, sa ibang mga plato at kutsara. Then, rinse with hot water and allow to air dry. Always allow to air dry para kasi pag sinarado nyo agad, babaho yung babaho at magkakaroon ng moisture, so pwedeng magkaroon ng microorganism. So you should air dry. Then, run only full loads to conserve water, soap, and power costs. Do not interrupt the dry cycle to save money. Bathroom. In bathroom, you should always follow from cleanest to dirtiest. Okay? Toilet is considered the dirtiest, so you should clean it last. Clean sink, countertops, shower tub with disinfectant. Use a brush to clean the toilet and brush under the rim. Do not combine cleaning chemicals, especially ammonia and bleach. This forms a toxic gas. Then, in cleaning bathroom, you should always remove all soiled towels. You should start cleaning the tiles shower down to bathtub. Clean and sanitize the toilet bowl. Scrub the toilet lavatory floor tiles. Clean the bathroom walls. Clean the mirror. Wash the drinking glass if applicable. Clean and rinse the lavatory and then make it dry. And install the faucet knobs. When you're removing trash, you should empty trash on a daily basis to decrease mold and bacterial growth. Rinse out and clean household trash containers with a bleach solution. If the client recycles, use appropriate recycle containers and empty into appropriate recycle bins. In dealing with clutter, the client must at least have clear pathways from the bed to the bath and for all exits. Laundry. So if you're using washing machine, we have two division or two kinds of washing machine. We have the front loaders and the top loaders. So yung front is yung pinto na bubuksan sa harap, yung top yung sa taas. Then checking and sorting clothes, you should always check clothing tags. Okay? Sa clothing tags kasi nakasulat kung instructions paano ilalaban to, itong damit na to. Then turn clothing right side out. Okay, so balik ta rin. Check all packets. Mamaya mayroong mga pera, may mga jewelries na nandun. So you should always check. Then check for sewing repairs. Kung may mga kailangan tahiin, may mga sira, dapat tahiin mo muna bago mo laban. Kasi pag nilaban mo, then tsaka mo tinahi, masisira siya lalo. Then check for stains. Sort the clothing. Okay, kung puro white, kung puro dark, puro dark. So before start washing, for the best result, separate dark from white, lightly soiled from heavily light garments. Any clothes in which color fast may be a problem. Close zippers and hooks and snaps to prevent breakage and snagging. Empty pockets, then remove non-washable belts. So what are the steps in successful washing? First is you sort the laundry. Okay, if it's white, put all the white and then sort all the dark. Pre-treat obvious stains. Okay, if you're pre-treating or you're ibabad mo yung mga may mancha, you can use different stain remover like vinegar or any acidic solutions. I'll show you later on. Then choose right water temperature. If you're using cold, it's only for fabrics for dark and black color clothes. If you're using warm, light to medium colors, and if you're using hot, it will be always for baby clothes and nappies, because you know babies are so sensitive and they have underdeveloped immune systems, so any infection or microorganisms which is available in their clothes, they can infect the babies. So it should be always be hot. Then adding laundry detergent and using fabric conditioner. So these are the removal agents that we are using. We can use the solvents like bleach and acetone. We can use detergents, acids like like lemon, lime, vinegar, and then alkalis, you can use sodium peroxide. If we're using dryer, remove clothes immediately when dry and hang up or fold. Do not put delicates in the dryer unless directed by the client. Some permanent press clothes will be less wrinkled if you taken out. Then always clean the lint filter after every load because buildup of lint can catch fire. If namamalansya naman kayo, always follow these rules that you never ever touch the plate of iron because of course it will burn you. Then if you are going to stop ironing for even a short period, you always turn the iron off. We don't know that we have children that can reach the iron and then can play the iron. So it's very dangerous. Then be careful not to tangle the cord while ironing. So what are the tips when we are ironing? First, always read the instructions on each item. Synthetic and silk, iron to low to medium temp. Woolen items, you should iron at medium to high temperature. Cotton and linens, iron at high temperature. Do not iron in circular motion as this can stretch the garments. Ironing trousers, pull the pockets out and iron them first. If ironing shirt, you should always iron first the collar with cuffs, sleeves, and then the body, and then hang up the items immediately. So preparing hot and cold meals, this is also asked by test the test the assessor. So they will ask you to prepare a dish for a certain age group, like uh toddler, like um school age children. So you should know how to prepare hot and cold meals. So it preparing hot and cold meals, it includes preparation of ingredients, cooking meals and dishes according to recipes, present, prepare cooked dishes, sauces, preparation of appetizers, dessert, salad, sandwiches, sauces, dressing garnishes, and preparing centerpiece. So, hindi lang pagkain ang ipe-prepare nyo dito, ang gagawin nyo dito, kundi paano nyo aayusin na appealing sa patient yung pagkain. So, if we're selecting or buying fruits and vegetables, we should consider these factors that can affect the quality of our fresh vegetable. First is the freshness. So as early as morning, you can buy, or this is the best time to buy vegetables and fruits. The absence of delay and insect infestation. Absence of decay and insect infestation, lack of mechanical damage of injuries, right degree of maturity, good weight in relation to size. Okay? Should remember also enzymatic browning. Ang ibig sabihin nun, pag ang apple, hiniwa mo at pinatagal mo ng ilang minuto, magiging color brown na siya kasi nag-oxidize siya. So, ang tawag doon ay enzymatic browning. So, if you're preparing vegetables, always wash vegetables under cool running water. Uh, Others, they are using a bleaching solution for vegetables, so it's very safe for the patient. For maximum retention of nutrients, peel sliced vegetables just before cooking. Hindi pwede na magluluto ka bukas, magpipil ka na ngayon. Kasi according to study, naglulose mo yung nutrients pag nagpil ka ng early. Then, thoroughly inspect and remove blemishes. Adjust the preliminary preparation like trimming and cutting. Then, cook vegetable for short time. Kasi pag pinatagal mo siya, mawawala yung mga nutrients. Pag nagluluto ka ng vegetable, do not overcook kasi ang dami ng nutrients ang nawala. Then, cook as close to service time as possible and in small quantities. If the vegetable must be cooked ahead, undercook slightly and chill rapidly. Never use baking soda with green vegetable. Cut vegetables uniformly for even cooking. Start with boiling salted water when boiling vegetable. Bakit may salt? Because salt can be a disinfectant also, or pwedeng, yes, it can be disinfectant that can remove microorganisms. Then, cook green vegetable and strong flavored vegetables uncovered. To preserve color, cook red and white vegetable in slightly acidic liquid. Then, do not mix batches of cooked vegetables. In storing meat, we should always maintain the freshness of the meat. So you should follow the guidelines or the temperature storage for the meats. So these are the frozen meat. You should store the frozen meat for 0 to negative 18 degrees Celsius or colder. So you should always practice the FIFO, first in and first out. So kung anong una mong binili, yun yung una mong tanggalin. Then, defrost the refrigerator. Do not refreeze thawed meat. Okay. If you remove a meat, okay, or frozen meat, and you thawed it already, pinalambot nyo na, pinatanggal nyo na yung yelo, then naisipan nyo na ibalik siya kasi gusto nyo na lang pala, tinamad kayo magluto, gusto nyo na lang pala mag-order. So, it's not acceptable because bacteria is increasing in that meat. Kaya hindi na pwede yung ibalik. Dapat lutuin na siya agad. Nag-multiply na siya agad yung mga microorganism. Then, keep freezer clean. Storing eggs, you should store the eggs 36 to or 2 degrees Celsius. Then, store eggs away from the other food that might pass on undesirable flavors or odors. Then poultry, we have white meats, dark meats, and entrails. White meats is yun yung breast part, dark meat is yung ibang remaining part, and then yung entrails yun yung mga lamang loob. So, in market forms, we can buy chicken, liver, whole, dressed, and ready-to-cook chicken. Sa fish naman, pwede natin silang i-classify sa vertebrate and invertebrate. So, qualities of good fish. Fish should look and smell fresh. The scale should be intact, firmly adhering and shiny. The eyes should be full and bulging, but not sure. Then the gills of the fish should be bright red. So in market forms, you can buy live, whole, and drawn and fillet fish. So we can also prepare salad and dressing to our patient. So salad is described as a dish which features one main ingredient or combination of ingredients and flavors. Salad dressing is the one you're putting to make it the salad appetizing. So it can be vinegar based or mayonnaise based. So we have different types of dressing, okay, listed here. Then we can also use garnishing. Okay, garnishing is a decorative accompaniment of the dish. So for those patient na mahirap pakainin, ang ginagawa nila is nag-garnish sila para mas appealing sa patient, para mas kumain. So you can use in your garnishing like herbs, herb sprigs, julienne of carrot, slivers of spring onion, and then roasted and chopped nuts can also add flavor. Then accompaniment, it can be vinegar-based or it can be mayonnaise-based. So appetizers, ito yung binibigay mo before yung main meal. Then classifications, ito yung mga canapé, which is yung mga small bite na biscuits or sandwich, which is usually cold. And then cocktails, which is like seafood or fruits. Then relish, it can be raw vegetables or pickled items. And then dips, perfect accompaniment for raw vegetables and crackers and chips. So these are the usual appetizers that we are seeing, and they are giving this to the patient. Dessert naman, yun yung last na binibigay sa patient. Desserts are considered as the grand finale of the meal. A dessert that is well presented and tastes delicious will leave a lasting impression. So kung ang main meal mo or kung ang appetizer mo is hindi maganda ang lasa, pero ang dessert mo ay masarap, it can leave a lasting impression na masarap ang lahat ng pagkain kinain ng patient. So, remember how you will set up the table for your patient. So, in setting up, you should place the you should place the there's a number here, you'll see. You should place the napkin on the left side. Then number 2 is the salad fork, dinner fork. So you have the dessert fork. Then you have the bread and butter plate, the dinner plate, then the dinner knife, then the teaspoon, then the soup spoon, cocktail fork, water glass, red wine glass, and the white wine glass. So these are optional. So these are the basic rules for table setting. So that's all.